Male Genitourinary Assessment for Nursing Students. Welcome to this video presentation on the male genitourinary system. As healthcare providers, it is important for us to have a comprehensive understanding of the male genitourinary system and to be able to perform both subjective and objective assessments of these areas. In this presentation, we will cover the anatomy and physiology of the penis, scrotum, testes, prostate, and urinary system. We will also discuss developmental competence and factors to consider for different age groups. Lastly, we will explore the normal and abnormal findings during the objective assessment of the male genitourinary system, separated by the penis, scrotum, and inguinal area. Anatomy and physiology. The penis is composed of three parts: the root, body, and glands. The root is attached to the pubic bone and contains the internal structures of the penis, including the urethra, corpora cavernosa, and corpus spongiosum. The body of the penis is made up of the erectile tissue that fills with blood during an erection. The glans is the rounded end of the penis that contains the urethral opening. The scrotum is a sac of skin and muscle that hangs beneath the penis and contains the testes. The testes are responsible for producing sperm and testosterone. The epididymis, which is located on the back of each testis, is responsible for storing and transporting sperm. The vas deferens carries sperm from the epididymis to the urethra during ejaculation. The urinary system consists of the kidneys, ureters, bladder, and urethra. The kidneys filter waste and excess fluid from the blood to produce urine. The urine travels through the ureters to the bladder, where it is stored until it is expelled through the urethra during urination. Developmental competence. Infants, during infancy, the penis and scrotum should be examined for any abnormalities in shape, size, or color. The foreskin should be checked for completeness, and the testes should be descended and palpable in the scrotum. Adolescence. During adolescence, male sexual development occurs. Assessments should include examination of the penis, testes, and scrotum for any abnormalities in shape, size, or color. The adolescent should be asked about any pain, discharge, or difficulty urinating. Teens, during the teen years, sexual activity may begin, and assessments should include screening for sexually transmitted infections, STIs. The teen should be educated about safe sexual practices and encouraged to ask questions. Adult males, during adulthood, the prostate gland becomes larger, and assessments should include examination of the gland for any enlargement, tenderness, or nodules. The male should be asked about any difficulty urinating, changes in urinary frequency or urgency, or pain during urination. Objective assessment. Assessment of the penis. During the objective assessment of the penis, it should be examined for any abnormalities, including hypospadias, a congenital abnormality in which the urethral meatus is located on the underside of the penis, rather than at the tip. Priapism, a painful and prolonged erection that lasts longer than 4 hours and is not related to sexual arousal. Phimosis, a condition in which the foreskin cannot be retracted over the head of the penis, leading to difficulty with hygiene and increased risk of infection. Paraphimosis, a medical emergency in which the foreskin becomes trapped behind the head of the penis, leading to swelling and constriction of blood flow to the area. Epispadias, a rare congenital abnormality in which the urethral meatus is located on the upper side of the penis, rather than at the tip. Peyronie's disease, a condition in which scar tissue forms inside the penis, leading to a curvature of the penis during erections and difficulty with sexual function. Assessment of the scrotum. During the objective assessment of the scrotum, it should be examined for any abnormalities, including absent testis, complete absence of one or both testes. Cryptorchidism, a condition in which one or both testes have not descended into the scrotum. Small testis, a testis that is smaller than the other or smaller than expected for the patient's age. Testicular torsion, a condition in which the testis twists on its spermatic cord, causing sudden pain and swelling. Epididymitis, inflammation of the epididymis, which can cause pain, swelling, and discharge from the penis. Varicocele, enlarged veins in the scrotum that can cause pain, swelling, and infertility. Spermatocele, a cyst in the epididymis that contains fluid and sperm. Early testicular tumor, a tumor that develops in the testis, which can cause pain, swelling, or a lump in the scrotum. Diffuse tumor, a tumor that develops in the tissues of the scrotum or testis, which can cause pain, swelling, or a lump in the scrotum. Hydrocele, a fluid-filled sac that develops around the testis, causing swelling in the scrotum. Scrotal hernia, a condition in which the intestine or other abdominal tissue protrudes through a weak spot in the abdominal muscles and into the scrotum. Orchitis, inflammation of one or both testes, which can cause pain, swelling, and fever. Scrotal edema, swelling of the scrotum due to fluid buildup. Assessment of the inguinal area. During the objective assessment of the inguinal area, it should be examined for any abnormalities, including inguinal hernia, a condition in which the intestine or other abdominal tissue protrudes through a weak spot in the abdominal muscles and into the inguinal area. Enlarged lymph nodes, swollen lymph nodes in the inguinal area may indicate an infection or cancer. The prostate exam. The prostate gland is an important part of the male genitourinary system and is located just below the bladder. It can be palpated during a rectal exam to check for any abnormalities, including enlargement or lumps, which could indicate prostate cancer or other conditions. Performing a prostate exam can be uncomfortable for the patient, so it is important to explain the procedure and obtain their consent before beginning. The following steps should be taken when performing a prostate exam. 1. Have the patient lie on their side with their knees bent towards their chest or in a knee chest position. 2. Apply gloves and lubricant to the index finger. 3. Ask the patient to take a deep breath and relax as you gently insert the finger into the rectum, aiming towards the navel. 4. Use your finger to feel for any lumps or abnormalities in the prostate gland. The prostate should be smooth and firm, about the size of a walnut. 5. Note any abnormalities, including size, shape, texture, and tenderness. 6. Remove your finger and dispose of gloves appropriately. 7. Document the findings in the patient's medical record. It is important to note that the American Cancer Society recommends prostate exams for men starting at age 50, or earlier for those at higher risk, such as African American men or those with a family history of prostate cancer. During a prostate exam, the healthcare provider should aim to identify any abnormalities in the size, shape, texture, and tenderness of the prostate gland. A normal prostate gland should feel smooth and firm to the touch, with a rubbery texture similar to that of the tip of a nose. If the prostate gland feels enlarged, irregularly shaped, or lumpy, this could indicate the presence of prostate cancer or other conditions such as prostatitis or benign prostatic hyperplasia, BPH. In addition, tenderness or pain during the exam may suggest an infection or inflammation in the prostate gland. It is important to note that a prostate exam should always be performed by a trained healthcare provider and that any abnormalities detected during the exam should be further evaluated through additional testing, such as a PSA, prostate-specific antigen, blood test, or a prostate biopsy. Testicular self-exam. Performing a testicular self-exam, TSE, is an important way for men to monitor their own health and detect any potential abnormalities in the testicles. A TSE can be performed monthly and is best done after a warm bath or shower, when the scrotal skin is relaxed. The following steps should be taken when performing a TSE. 1. Examine each testicle with both hands. Place the index and middle fingers under the testicle, with the thumbs on top. 2. Roll the testicle gently between the fingers, feeling for any lumps or hard spots. 3. Note any abnormalities in the size, shape, or texture of the testicles. 4. Check the epididymis, a soft, tube-like structure behind each testicle that collects and carries sperm. It should feel smooth and slightly firm to the touch. 5. Repeat the process with the other testicle. It is important to note that it is normal for one testicle to be slightly larger than the other, and for the testicles to feel somewhat lumpy. However, any significant changes in size, shape, or texture should be brought to the attention of a healthcare provider. Men should perform a TSE monthly starting from age 15 to 16 years old. It is also recommended for men to continue to perform TSEs throughout their adult life as the risk for testicular cancer increases with age. In addition to performing regular TSEs, men should also have regular checkups with their healthcare provider to monitor their overall health and detect any potential issues early. Conclusion. In conclusion, a comprehensive understanding of the male genitourinary system and the ability to perform both subjective and objective assessments are important skills for healthcare providers. During subjective assessments, healthcare providers should ask about any pain, discharge, or difficulty urinating. During objective assessments, healthcare providers should examine the penis, scrotum, testes, prostate, and inguinal area for any abnormalities. With this knowledge and skill set, healthcare providers can ensure that their male patients receive the best care possible. Thank you for watching this video presentation on the Jarvis Physical Assessments Chapter 25 Male Genitourinary System.